Hi, Jerry Agar in for Ezra Levant. I've been talking about healthcare here on The Source today. Time to hear from the front lines, and Dr. Roy Eapen is a Montreal endocrinologist. Dr. Eapen, welcome.
Hi, Jerry.
So I'm always given to understand that while some cranky talk show hosts like myself may complain about the Canadian healthcare system, doctors are gung-ho in favor of it. It's all going just really well for you, right?
Well, I mean, there are some parts of it that work, but a lot of it that doesn't work. Long wait times. It takes 7 or 8 months to come and see me. Many of my colleagues, it takes even longer to see. Surgical wait times are worse, as the Fraser Institute said this year, and I think we're spending a lot of money and not getting good value for the dollar.
Well, it seems like then you're feeling like you can't do the work you got into the business to do, to help people and to help people immediately.
Yes, that's very true, and you know, part of the problem is that we have old thinking. We don't seem to want to change the way we do things in this country. You know, most countries in the world and most countries in the OECD have a mixed private and public health system, and that seems to work very well. We rank in the bottom half of the OECD countries in terms of healthcare outcomes, and we're also ranking in the highest numbers in terms of costs. So, you know, we do a lot of things well. We do a lot of acute care well, but a lot of things having to do with the day-to-day care take infinite amount of time, and I think a lot of Canadians are unhappy about that.
Well, doctor, you talked about how long it takes to come to see you, but if I want to come see you, don't I have to see somebody else first? And that is an issue as well.
That's right. And in Montreal, many people don't have a family doctor. In fact, many of my patients seem to think I'm their family doctor, and I'm not. And part of the problem with them thinking I'm their family doctor is that they end up seeing me more, and I don't see other new patients.
So if you could suddenly be the king of Canadian medicine, what would you do?
Well, I mean, I've written about this several times in various places. I think that we should allow some degree of private health care. I think that right now a lot of people end up getting, you know, people seem to think we have a uni-tier healthcare system. That's nonsense. We have a multi-tier healthcare system, and it's really based on who you know. And I think it would be fairer to at least let people who, you know, if they wanted to pay for it, get things done a little bit more quickly. And I've always sort of wondered why, you know, if the patient wants to come and wants to pay me, why is that illegal in this country? I mean, any other such transaction in this country is perfectly legal.
Well, I think it's incredible that we have this notion that two adults can't make an agreement with one another, that I'm sick and you know how to fix me, and we could put a deal together. And you're right that this idea that we have equal access for everybody is foolish. Everyone, I'm sure, knows stories of if you know somebody at the hospital, if you know somebody who knows somebody, if you have the money to go somewhere else, as we've been talking about here, whether it's to another province where you might get access at a clinic or to the United States, you can do so. And human nature, doctor, is such that there are people who can always find a way around, can find a solution, can look after themselves. But then what happens is the people we set this system up to help are the ones who are pushed further back in the queue.
And that's absolutely right. The people who probably get the worst service are the poor and the elderly who don't have people to push for them. Because basically in this system, you need an advocate who's pushing for you, or else you don't get what you need. I mean, in acute circumstances, we do a pretty good job. But you know, try to get your hip fixed, or try and get your knee fixed, or any number of other surgeries. Or try and get a colonoscopy in Montreal. That's a big problem.
Have you seen a situation, because I've mentioned this kind of thing on my radio show, and I've had people say that I'm just fear-mongering. Have you seen situations where a person came to you and the condition actually literally worsened during that wait time they were forced into?
Oh, absolutely. I mean, that happens all the time. And you know, if you don't see me for 6 months for a medical problem, it's often gotten much worse, and I often have to do more things for that person. And you know, I can tell you stories of friends of mine. A friend of mine was supposed to have his father was supposed to have a colonoscopy, and it was scheduled 7 months in the future. I told him to go to a private clinic, which would have done the colonoscopy quite soon, and they found out he had a rectal cancer. and he got that removed in the public system, but he got that done quickly, and he's doing well today.
But he's your friend. Couldn't he have come in sort of like after 5 and you'd have fixed him?
I could have done it that way, but I thought it was more fair not to push aside people in the public queue, to do this privately, where he was taking himself out of the public queue and still getting the service, which is another reason why we should allow some degree of private health care. I don't say we should have only private health care, though there are systems in the world, like Switzerland, for instance, which has very good health care, which is all insurance that pays for it. And if you can't pay for the insurance, I think the government will help you with that.
All right, your friend went to a private clinic where?
In Montreal.
Okay, and then who paid for that?
He did.
Okay, so what did that cost him?
I think it cost him about $500.
I think if I were your friend, I'd offered you $250 to see if you'd do it. But, but see, that's the kind of thing that should be allowed to happen, I think.
Competition is good. I think one of the other problems in our healthcare system is the way we fund hospitals. Hospitals are funded in a way that they think patients are the enemy. If it's a cost for them to see a patient, we should pay the hospital when the patient comes to the hospital. We should make it that the hospital wants to get patients. So the way we give money to hospitals, we give them a block grant, and an extra patient is more money for them off the top.
All right, Dr. Eapen, let me circle back with you a little. I said, I'm given to understand that doctors like the system, and we certainly do hear from groups of doctors who say the system is great and we just need to fund it. But what percentage of doctors do you think have the same viewpoint on this that you do?
Oh, many, many, many. We've had two presidents of the Canadian Medical Association, Dr. Day and Dr. Ouellette, who have private clinics, and they were elected, with sound majorities. I would say at least half of the doctors in this country would probably be in favor of some degree of private care, as would a substantial number of people in the public. I mean, if you actually ask them, would you like to be able to get your care a little more quickly if you had to pay for it? I think a lot of people would say yes.
Yeah, yes, they would. I believe, and especially it turns out low-income people on some research that I've seen. Thank you so much, Dr. Eapen.
Thank you, Jerry.